Nice. Oh, it's working. All right. Well, we were having some technical difficulties. Imagine that. But anyway, all right, still getting some glitches, so I am hoping this is working. But anyway, um, this is a Q&A with Dr. Agin. I really appreciate everybody that listens to what I have to say. Basically, just trying to bring you information that can help everybody live better lives and feel as good as they can mentally and physically. And so today we have a topic, and we picked vitamin D. And there's a couple of reasons why we pick vitamin. Well, there's lots of reasons why we pick vitamin D, but most importantly, I think is right now there's been some mention of vitamin D. It's been in the news a little bit. I know it's been on people's minds just because I think it was really brought to the forefront during the pandemic, where there was a article published in one of the journals of, I think it was endocrinology, but it was done by looking at Spain, and they found that 80% of their hospitalizations of the people that were hospitalized had low deficiencies in vitamin D. I think that really kind of sparked some attention, and it kind of snowballed from there to where people really started talking about vitamin D and how it can affect our immune system, and specifically some of the other benefits. But distinctly, vitamin D got kind of pushed to the front, or at least into the light, just because of that article, and then people also finding other doctors also finding similar findings that people that had lower levels of vitamin D had higher frequency or longer frequency or duration and frequency of viruses and other and COVID, of course. But there's a lot more reasons to talk about vitamin D just than COVID. It just was one of the things that I think that really brought it to the forefront. But I've been tracking vitamin D levels, and I know vitamin D deficiency has been kind of a ubiquitous problem for since I got into medicine. And and I came from Michigan to Florida, so I thought that getting into the Sunshine State, we'd see a lot of people that didn't have vitamin D deficiencies, and I was pretty shocked when it was really just as bad as it was from people that were in the north, and especially in cities that have less sunlight. So we'll get into some specifics, but let's just kind of go through a little bit I want to cover everything about vitamin D. There's not going to be as much on this topic as there are some other ones, but I just wanted to make sure everyone understands the importance of it. So let's just, so that's kind of why a lot of people are interested in vitamin D now. But this has really been something that we've always known. Specifically, one of the problems is, and this is, you can take this for what it is, but ever since I've been in medicine, the amount of vitamin D that the American Medical Association and the United States Institute of Health, the recommendations for vitamin D supplementation are always somewhere between 400 and 800 IUs. This recommendation changed a little bit. I think they went up to 1,000. But what we found through our years of medicine is that people that take anything less than 5,000 IUs tend not to get into that range of normal, which is 30 to 100 on a lab slip. So we've kind of known that we've had to bump up our vitamin D amount just based off sun exposure and some other things which we'll talk about. But it's just interesting that we're having a pandemic is what brought vitamin D to the forefront, but yet we've known these things for years in medicine, and we still don't recommend to doctors and consumers the right amount of supplementing vitamin D, knowing how important it is. So I just find that funny, but we have known this. And so let's talk a little bit about vitamin D. So vitamin D is a fat soluble vitamin, and so that'll be important when we talk about can you take too much. But vitamin D is a fat soluble vitamin, but it's also considered a prohormone, and why that is because it has similar effects to like a steroid. And just like our steroids are all produced from cholesterol, so cholesterol actually converts to vitamin D. And so we have two forms of vitamin D, vitamin D2 and vitamin D3. Vitamin D2 we get specifically normally from plant sources, and vitamin D3 we get from animal sources and sunlight. And so both of them then can get converted into a storage form of vitamin D called calcifidiol. Sorry, all these the technical names of all the different vitamin Ds are really it's not the importance of this, but anyway, so they both get converted into a storage form of vitamin D that circulates through the blood, and that is what we can pull from. So when we're talking about the vitamin D2 and vitamin D3, the differences between them is that vitamin, as far as they both can convert into our storage form of vitamin D, but yet vitamin D3 is more efficient at converting into that storage form. So, and then the other part of it is that vitamin D2 is the less expensive of the two, and also can be found in a lot of the supplements. And if it's in the supplements, there's a lot of question on quality of the supplements. And vitamin D2 again doesn't convert into the storage form of vitamin D as well as vitamin D3, and we get vitamin D3 from our sunlight naturally. So that's one of the important things when we talk about what got us into this situation. When we're talking about the importance of vitamin D, how it's a prohormone, it targets 2,000 genes in our body. They've been watching vitamin D pretty heavily in other countries and know the importance of it. I know that there are studies going on with because of how vitamin D affects the immune system. They also looking at it as how it can affect autoimmunity and also be an immune modulator. So in Canada, I know that some doctors there were giving vitamin D injections for people with lupus flares, again, just because of how powerful it can be for the immune system. But most of us know vitamin D for strong teeth and strong bones, which is exactly what is one of the main important reasons for vitamin D. We for people that are a little older will remember the people with the bow legs and rickets. And that's just from calcium deficiency. So if you don't have enough vitamin D, that is the main thing that we need our vitamin D for, is to help improve the absorption of calcium from the intestines. And calcium is a mineral and can be a little bit difficult to absorb in the gut. And remember, all of our guts are sometimes questionable as far as just how successful they are at absorbing any of our nutrients. But calcium is one that's a little bit more difficult sometimes to absorb. And so that is what vitamin D does. Vitamin D helps remove calcium, absorb calcium from the intestinal tract, and then we use that for various things in our body. You might also hear people talking about vitamin K2. So kind of the trio that most people will talk about with when we're talking about vitamin D is vitamin D, calcium, and vitamin K2. And what vitamin K2 does is it actually helps direct calcium to our bones and to the areas that we want it in, that we need calcium. And so, don't get vitamin K2 confused with vitamin K1, because vitamin K1 is the one that is converted in the liver to help in the clotting cascade. So that's the one that you can't take when you can't take vitamin K when you're on Coumadin and other blood thinners, and the one they talk about with thinning of the blood. Vitamin K2 is the one that works outside of the liver and in the blood, where it helps with calcium reabsorption and absorption. So resorption and absorption. So it actually can help with pulling calcium out of the walls of our arteries while also pushing calcium into our bones. And so that is why K2 is sometimes supplemented with vitamin D3, because it helps kind of get the absorption, improves the absorption and the direction of vitamin D to the areas that we want it to. So as you know, what calcium is, if we don't have enough calcium, it starts pulling from the bones. So we need enough calcium, we need enough vitamin K2, and then we need enough vitamin D3. Vitamin D in general. And just like vitamin D3, vitamin K2 we can get from animal products, fermented foods, and so there's also sources of that. One of the reasons why we need to supplement it is just like I always say, supplements used to be something that we would say, supplements are for supplementing a healthy diet that's full of the right amounts of fruits and vegetables and protein, but yet we know in our diets we're not getting the right amounts of protein and we're not getting enough fruits and vegetables. So therefore we need to supplement with vitamin D or get sunlight. And so that is kind of why we're having this conversation, is because we talked about how important vitamin D is. We talked about how the population's deficient. Right now, they're saying somewhere between 40 to 50% of our adult population is deficient in vitamin D. But I can tell you, I draw a lot of blood on a lot of people throughout my whole career, and I don't know where they're getting 40 to 50%, because I would say the vast majority, I'm saying somewhere around 70% of the patients that I draw blood on, especially if they, if this is an initial visit and they have not gotten onto a supplement regimen after we go through their blood have vitamin D levels below 30. Normal range is 30 to 100. Our goal is 60 to 100. So they can say 40 to 50% of vitamin D deficiency, but I say it's a lot higher. And we pretty much put people on 5,000 IUs continuously, or we give vitamin D3 injections, which I will talk about in a few minutes. So we know how important vitamin D is, and we know all the different things that it does for the body. So when we talk about just bone and teeth development, especially as before the age of 35, calcium and vitamin D are essential for forming strong bones and not weak bones. But then as we age, it's also important that if you're not getting the right amount of nutrients in your diet, it is also what will start pulling from the bones if you don't have enough calcium. So there's it's just kind of a balance. Some people use the analogy of a bank account when you put money in and then taking money out if you don't have enough. And that's kind of what it is with calcium in your in the bones. And so that's what increases risks of osteoporosis as we age, especially in women, once we start having hormonal changes. But again, most of the population is deficient. So if you know that, if you haven't had your vitamin D levels checked, go get them checked, because supplementing is very easy. Even if you can't get enough in your diet, there are plenty of good oral supplements. Just remember that you want between 5,000 and 10,000 IUs depending on your level. We usually tell people that if they're under 30, we would suggest injections, and I have some good news to talk about as far as the injections go, until you get at least up to some are close to 60. I mean, if you're above 40, you can do oral supplementation, which is going to be between 5,000 and 10,000 IUs. Once you get to 60, you can just stay on 5,000 IUs continuously. Through my years, I don't see anybody that's on 5,000 IUs getting into toxic levels. But just a reminder again, vitamin D is a fat-soluble vitamin. It's not like the B vitamins, that are water-soluble, that you can pretty much take whatever you want. Your body's going to use what it needs and then metabolize and then secrete whatever it doesn't use. This is a fat-soluble. So there are cases where I see patients that are taking way too much vitamin D because they don't mention when they're talking about how important it is for the immune system and how important it was to help battle COVID, that people were taking 30,000 IUs a day. They were coming in and they had levels above 100. And if you get really, really high on your vitamin D, you can create a little bit of a crisis because of what it does to your calcium balance. So definitely check your levels. Don't go too crazy on the amounts you're taking, but yet you definitely need to look at doing supplementation correctly. Now, when we talk about sunlight, so it's part of the reason, vitamin D3, you can't overdose on the D3 that is converted from the sun. And we have receptors in our skin, and we have a certain storage form of vitamin D that is converted from sunlight in our skin into a usable form of vitamin D3, which again, you can't overdose on your own production. And so as you look through kind of the history of just health and wellness, and you look at the fact that the American Medical Association, the Institute of Health, and these various institutes don't recommend a high enough amount of vitamin D3 in supplements, knowing that we are deficient in vitamin D3 and knowing how powerful vitamin D is for our body as a prohormone. Without recommending it, you also start to wonder about sunlight. Yes, we do want to protect ourselves from skin cancer, but that doesn't mean you can't ever be out in the sun. I know, again, being in my 50s, we kind of know that when we were growing up, we didn't do the right things as far as sun exposure. But I can tell you, we seem to be a lot overall healthier at that point, and it was because we didn't really wear sunscreen. And so now we're in a situation in society where we wear sunscreen pretty much everywhere we go. They made them to where they almost cover our skins and don't even let the skin breathe. And so we're just kind of blocking our ability to get vitamin D naturally, and they're not recommending the amount of vitamin D we need to actually be efficient and effective for us. So you just have to think that you do not need to have your sunscreen on all the time, unless your dermatologist says that your skin is so bad and you're so at risk of skin cancer that you can't have any sun exposure. Then I suggest that you start to rethink about getting direct sunlight. I mean, we know how important sunlight is, and if you can go out in the sun, getting sun is not bad. Burning is bad. And so you can get out in the sun for 15 to 30 minutes every day with direct sunlight on your body without getting burned, most people. And so just don't always put on sunscreen unless you have direct risks for getting skin cancer. What you have to do is just go to your dermatologist once a year, get a skin over checkup where they look over your whole body, because sunlight's that important. And so that's one very important thing, is that you can still get direct sunlight. Don't get sunburn. Get the direct sun, then you can put some sunscreen on, but just be outside. That is really important. We're all, working from home. We're staying inside. We're not getting out and getting the type of exercise and exposures that we need, and it directly affects our health. So what I was going to tell you that's really exciting is that we have been interested, and we've had so many people ask about doing vitamin D3 injections, because for those people that are under the level of 40, I mean, you can say even under the level of 60, but especially under the level of 30, which is a large percentage of the population that don't even know it, you definitely could benefit from vitamin D injections. And like I said, they've used vitamin D injections in other countries for multiple different reasons, for the flu, for autoimmune disease. And you're going to start, although if you looked and if you talk to certain doctors, they're going to tell you there is no evidence that vitamin D can help reduce plaquing in our blood vessels, that can help with reducing our risk of cancer, reduce our risk of just general mortality. They might agree with the bones and the teeth, but it gets way deeper than that. When you're signaling 2,000 genes and you're actually considered a prohormone, that is because it has that much impact on our bodies. And so it starts getting into where people say it can affect mood, it can affect diabetes, because remember, if you can improve your immune system and reduce inflammation, you can see how that could be used in any autoimmune disease or any chronic illness, as well as be beneficial for promoting anti-inflammation. So then it could also be a disease prevention tactic. I just love that they brought up vitamin D as far as the immune system, and how it directly was related to the severity of COVID cases, and especially hospitalizations, because it did make people jump in and say, oh, I got to start taking vitamin D. A lot of people just took too much. So hopefully our little discussion has you kind of understanding what to do with vitamin D. But now our great thing is, with telewellness, we can actually prescribe vitamin D injections online, because we have an ability to upload, if someone has their own labs, that we can take a look at them, because it is a fat soluble vitamin. So we do have to manage it correctly. And if you don't have labs and you don't have a primary care doctor that you can get a vitamin D level from, we can also send you a requisition, and you can go get your vitamin D level done in your state, and then we can work with you to get your vitamin D levels up a little bit faster, so you can be protected and obviously get the benefits of what we would say is normal vitamin D levels. So that is really exciting. I mean, we always are trying to bring as much as we can to people, so they can kind of really work autonomously on their health. And so this was a really nice one, because it is such a really important a vitamin. I mean, this is again something that we've known for years, and I've been promoting vitamin D in my clinic since day one. But for whatever reason, it's out there now, and I think it's at least awakened people to go get their levels checked and get on the supplementation, and that's the great part about it. So I'm going to just summarize a little bit again. Vitamin D, it's a very chronically deficient vitamin. It's a fat soluble vitamin. It's just not known for just the benefits of bones and teeth, especially in puberty and before up to the age of 35, where it's really important for bone development. It does a lot more because of the way it works on inflammation and our immune system. You can use it for reducing the symptoms of autoimmune diseases like lupus, rheumatoid arthritis. Vitamin D deficiencies are associated with, I think, 17 different cancers. It's important for mood, as I mentioned. Vitamin D, along with the other parts of the trio, can help with pulling out calcifications from our arterial walls. And like I said, vitamin K2 is the one that's really helpful with that, especially for our arteries. And so, there's two forms of vitamin D. There's vitamin D2 and vitamin D3. Vitamin D2 is very often found in the supplements, so just make sure you look, because you can get vitamin D3 in a supplement. We do get vitamin D3 from our food, from animal products, as well as from sunlight. We get vitamin D2 from plant sources. And just remember, vitamin D3 is a more aggressive converter into the storage form of vitamin D so that we can use for our body. So that's why people prefer vitamin D3 over vitamin D2. And in the supplements, they use vitamin K2 in the supplements because it helps direct when the absorption of calcium and directs it into the right direction, so it's not being put into plaquing and stuff in our vessels, but used for our bones and in the tissues that need it. And then lastly is testing and supplementation. So just remember, we don't get enough from our foods. Most people aren't getting near enough sunlight. If they are getting sunlight, they're using sunscreen. So don't be afraid of the sun. Just don't sunburn. If you're worried about your skin, go get an evaluation from a dermatologist. Once they say you're clear, do not be afraid to go get some direct sunlight. It is super important for our health, and not just vitamin D, but for mood and for just for naturally nutritional wise for our body, because our skin's our biggest organ. So just get some direct sunlight every day if you can. And then also supplementation. You need to get those levels above into that 60 to 100 range. And so don't listen to the recommended dosing. It's not accurate. So we want somewhere between 5,000 and 10,000 IUs until you get well over that 60 mark. We just talked about injections. If you guys are interested, let us know, because we can help you with vitamin D3 injections. We can help you with the labs. You can get labs and send them in to us, but that can really help, especially people that do have autoimmune diseases or other inflammatory conditions, diabetes. Get your D3 levels up and watch, along with other lifestyle changes, how that can do to improve your overall health. So just remember, they also did a study that showed that people with vitamin D deficiencies had an overall higher risk of mortality or dying. And so that should be all you need to know. But anyway, that was vitamin D, and quickly, but hopefully you just took the most important points out of that. And thank you again. We'll have another good topic next Wednesday for Q&A with Dr. A. So stay healthy, everybody.